Hi, and welcome to the Embouchure Project Podcast, where we bring together the finest minds in the world to help understand the complex system that is the embouchure. The Embouchure Project represents a network of neurologists, scientists, physical therapists, psychologists, and pedagogues. The goal is to help define what a healthy embouchure is, what we can do to optimize the embouchure, and to deal with problems as they arise. A lot of our time will be devoted to embouchure dysfunction, from minor annoyances to debilitating forms of dystonia. We hope that all players, teachers and medical professionals will find this to be a rich resource. My name is Frankie Lacerdo. I'm a horn player with the West Australian Symphony Orchestra, founder of Brass Rehab, and on faculty as a teacher at the University of Western Australia. Thank you for joining us. We hope you find this to be informative and helpful. The Embouchure Project would like to thank the Australian Society of Performing Arts Healthcare and the Glenn Gould School for their support. Dr. Ackermann is Associate Professor of Biomedical Science at the University of Sydney and the Sydney Medical School. She's a specialist in musicians' physiotherapy, musculoskeletal anatomy, and musicians' health. Her interest in performing arts health grew as a result of working with the Sydney Symphony Orchestra beginning in 1995. She's been active since then, researching and treating musicians' health, focusing on performance-related injury prevention, injury assessment and management, optimizing performance through enhancing physical and psychological well-being, and understanding the anatomical, physiological and biomechanical mechanisms underpinning musical performance. Bronwen's commitment to the world of music performance has saved and enhanced the careers of countless musicians, including my own. Let's meet her now. Well, welcome back, Bronwen, to the Embouchure Project Podcast. I just thought I might start with getting you to give us a little bit more of a medical background of yourself. So for this podcast, we really want to aim it at medical professionals and give them a little insight into injuries for musicians, but specifically embouchure dysfunction and what's out there, what's being done at the moment, what needs to be done, or is training possible if you're not in this field already. Because you didn't really start in this field, did you? Maybe you could give us a little history.
Sure. I mean, physiotherapy-wise, I started in sports medicine, like a lot of us do, and worked at a very elite sports medicine clinic. And what was interesting was how much we focus on, very minute details when it comes to athletes really trying to understand the demands and how it relates to performance. And this was back in the early 90s, and we had a lot of performing artists start to come to us because they were looking for people who would really analyze what they do and try and think a bit deeper, because a lot of the problems are very unusual to us. We don't get trained about it. So when someone's saying, oh, I can't move my fingers fast enough for this passage, this is kind of unusual. We don't get taught backgrounds like this. So I started working with musicians from the early 90s, and back then there was really no information. There was very, very little. A group in America was starting this Performing Arts Medicine Association. That was kind of the only group you could try and find information out. So I did a lot of research myself. I was encouraged by the musicians. They were very keen for me to try harder to work out their problems. So I went back to very core anatomy, and I also am an associate professor of anatomy at Sydney University. So I used that to really dig deep through literature, and I had to go back many, many years, often to the 1960s, to try and find information to piece together this complicated puzzle when it came to the embouchure. As physiotherapists, we're not taught much about the orofacial or the structures internally in the pharynx and larynx. We get taught about lungs. We get taught a little tiny bit about the face, but not much about all the workings within. At the moment, mostly that gets taught to speech-language pathologists, but mostly in the context of stuttering and swallowing, not a lot to do with blowing against resistance and all the fine-tuning it requires to use your mouth and tongue and all this apparatus in order to make a sound in a musical instrument. And this is very face athletics. I mean, it's really, really complicated task, and timing's very important, and using the structures well. So I became quite fascinated. Originally, I had, when brass players came to see me saying, oh, something's wrong with my embouchure or my tongue's turning sideways, I would think, gee, that's a shame, go and see a speech therapist. I don't know what to do with that. And then I started looking a lot deeper and trying to help them as much as I could. Over the years, some of this culminated like working with Peter Iltis a little bit in Germany, looking at fMRI of what's happening inside the oral cavity and things when we're trying to produce sound on a musical instrument. So it really has been a long process, somewhat begrudgingly pulled into it initially, very encouraged by the musicians who wanted me to help them. And then I just became fascinated by it because it was so hard to find out information about the embouchure and how all these areas work together. Our information's much more about asthma or maximum volume of lungs and kind of athletic breathing or illness breathing, not about blowing into resistance or modifying airflow to create specific sound effects and things. We don't learn about this. So.
Yeah, I guess from a musician's point of view, obviously we know each other because I had an injury and I couldn't play anymore, and you helped me get back to work. But from a musician's point of view, and looking into studies not only that you've done, but around the world, the same statistic keeps popping up. Around 60 to 70% of professional orchestral players will have a career-threatening injury at some point. Now, that's not necessarily an embouchure injury or a physical injury. It could be a mental injury, but we're talking more than majority, and that statistic keeps popping up. And so from a musician's point of view, like, yeah, we really want people like you, because it's hard to know who to turn to, and there doesn't seem to be that many people in the world that are specific in this area. And it's funny you mentioned your reaction, like go to a tongue specialist or go to a ear, nose and throat, because even going through workers' compensation or insurance, luckily I had you to see, and we were getting results, but they still wanted a second opinion from an ear, nose, throat specialist who this is their specialty, but working musicians with musicians wouldn't be. So like from a musician's point of view, our big thing is, who do we turn to? Luckily in Australia we know you and some people, but yeah, maybe you could flesh that out.
I think as the first step, one of the important things with always getting what the medical people usually do is check for anything untoward. Like they can check to see if there's particular, what we call like velopharyngeal insufficiency, where your soft palate doesn't meet the back wall of your throat properly, so air can come out your nose, and various other kind of conditions can be medically screened by, like you said, an ear, nose and throat specialist or laryngologist. These kind of people can look at very specific functions to it's important to make sure you eliminate a pathology, like a disease, like a tumor or like sometimes when the soft palate isn't working properly, maybe as a kid you had your adenoids out and there's a little bit of a hole in the back of your throat where that was removed that's causing a problem. There's all sorts of things that the medical specialist can help with. However, one thing I would say in general in medicine that we address very well in fields like sports medicine, but not so much in general medicine, is we're trained, it's changing, but we're trained in a bit of a deficit mindset. So looking for a lack of function rather than looking for a lack of hyperfunction. So with musicians, you've got to do things that quite simply no one else can. And when they can't do that, they can't play. Now, a lot of the stuff I've done in a lot of research with musicians over the last 30 years, is looking at trying to take measurements of function. And very often a musician will be performing sub-maximally, but in clinical tests, like looking for pathology, they will come up normal because what you do is above normal. And that's one thing where medical professionals dealing with musicians need to realise that the kind of speed that your tongue works at, there's coordination between your inner cheeks, your mouth, your breathing, your tongue action, is way above what we would do in normal everyday life. Therefore, our assessments need to be extended accordingly. So we wouldn't say to a golfer, well, can you touch your toes 10 times or something? You should be fine to play. We don't do that in sports. We've kind of cottoned on to the fact that they need to be able to do something outside the normal. And same with music. We need to, when we're looking at things like, especially with embouchure dysfunction, the whole system's very interdependent. I mean, just speaking a minute as an anatomist and a clinician here, this system is very mobile. Like a lot of the structures inside the throat and mouth and on the face are designed to move. You know, we can sort of move all the muscles on our face to make facial expression, move our tongue around to move food inside our oral cavity and things like this. So when you have a very mobile system, it's a bit different from muscles that, say, go from a bone to a bone, and they're kind of reliable in what they do. I mean, they can move from one end or the other end, but the bones kind of dictate it. In this kind of oropharyngeal apparatus, often things are connective tissue connected for health professionals, which means if the timing's not right, the whole way the structures contract can be very, very wrong. And that's really important when dealing with things like embouchure dysfunction, because sometimes the timing is so critical and really the person is just contracting everything in the wrong order, or, sometimes fatigue creates these compensations that lead to this whole cycle of mistiming and complete inability to play very often, that comes from the fact the system isn't stabilised sequentially in the right way.
I guess from personal experience, but from a musician's point of view, it's something we just don't learn at all in the brass world about what the muscles are actually called, what their roles are. And then so when something does happen to you and you have to learn again, I mean, what was very natural for us, all of a sudden we've got to figure out the timing, and you just have no idea about how to do it again. You can try in a mirror, but this is where a lot of musicians, speaking from a musician's point of view, are a bit scared of this paralysis by analysis of thinking too much about it. But yeah, when you present at that point where there is no timing, there is no strength, and you have to piece it all together. Timing is a huge thing, and it's such a hard thing to explain to not only to a medical professional, but to other musicians that haven't gone through it. Yeah.
Absolutely. And I think exactly what you said, that culturally, I think what's important for medical professions is to understand it's quite fearful for a musician to talk about, all the muscles of the face when they've been taught not to think about them. I mean, it's analysis paralysis. I don't think a lot of medical professionals would realise actually how vulnerable you are to injury, because you simply don't know what to do. And it's a bit of a stigma talking about embouchure, because you will hear a lot of different opinions, often based in good intent, but not necessarily in having any idea that how these sort of structures work together and in what kind of order. And I think your comment when we worked together, that it was like Mythbusters, is important for medical professionals to realise that really we have to be understanding that you guys are coming from a place of deep, well, it's very fearful having your face not working. I mean, you just have no idea what to do. It's sort of outside of your sphere, and in fact, it's outside of a lot of health professionals' sphere, so you feel very lost and alone. But we have to be logical about it as health professionals and assess symmetry on sides of the face, for example, assess strengths of oral dilators and constrictors, have a look at the strength of muscles inside the mouth, larynx control, all these things. We can take the parts of embouchure through the whole chain. Right? It really is, it's interesting because breathing is not, we're making an aperture in a way that allows air to come into the instrument in a controlled manner. Like if you're a brass player, obviously we want to have the lips able to vibrate to create that interruption in the airstream, the so-called buzz that makes sound. But we've got to organise our lips to be in the right amount of tension and the right amount of aperture size for the different instruments. And then the air comes through and provides the engine for that buzz. But holding the shape is a different thing from providing the air. Often if people have problems for quite some time, one of the really big problems is the air doesn't get there anymore. They're kind of contorting and worrying and making all these facial things and trying to somehow make a buzz out of nothing. And, to sync these sequences back together is also important. You can't just do something local to the lip without looking at how it's working functionally, how the system's working functionally as a whole. I mean, you experience this. It's very common that the compensations lead to you without intending to, doing anything you can to make the sound work. And then, as health professionals, we need to undo it. So I normally go through the whole system, go through kind of control of the height of the larynx, check how the larynx itself is functioning. Are you having noisy in-breaths? Is it kind of getting sort of moving sideways because of head tilts and other things? Does the tongue know where it is in space? Because, our hyoid bone is the root of the tongue. And this is very important for musicians, that they have some control of the tongue position, because, of course, the tongue's the only muscle in the body that's only attached at one end. So we have to make sure that end that's attached to the body knows where it is in space. So there are a lot of things like this. And I think I used to also just look at the jaw and face, and it's really, to really do embouchure retraining well, you have to look at it systemically and kind of, just get the flow in the system working in the right order and make sure the kind of symmetry and control through that chain is working. It's much like in sports medicine, for example. A lot of people would be familiar with kinetic chain action, and what that means is moving from the center outwards normally. Sometimes it's reverse, like, for example, gymnasts might be holding like those horse things and spinning their body around, like it's incredibly complicated. It's kind of using all the muscles backwards. But we do understand this kind of concept that timing is very critical for function and the way and the direction we're using muscles. So I think that's the thing. People don't necessarily look through the whole system. They might look, this muscle's moving funny here, try to relax it. But it's more, we need to think, why would it be doing that? What's it? What would be driving that? Because especially a professional like in your case, when you have a problem, it's not coming from you didn't realize you shouldn't do that. I mean, you shouldn't do it. It's other things are taking over. So it's usually we have to start looking at why is that compensation happening? What's not there? What's out of time, or what's not functioning that's causing that glitch, if you like.
The body's so good at compensating for either muscles or neighbors that aren't doing their job properly. Something else steps in and saves the day. And so I like talking about this whole system thing. It's not just all up here, but obviously with breathing and the amount of support that brass players need to create sound, it's different from just everyday talking. And there are actually teachers that would say it's just like breathing in and out like that. And that's just fantasy.
Absolutely.
It's just not like that. Obviously singers have been around since forever. And I feel like singers are so much further ahead in understanding of the anatomy of breathing and support, and brass players are kind of catching up. But do you feel like there's work that needs to be done in the medical field with teaching that part of things, or is that pretty well? I mean, obviously it's well understood. It's a different ballgame to this, but
I don't like singing is a bit different because, quite frankly, if you don't have, like, your body is your instrument, you have no choice but to learn how to use it well. And I think with brass players, if you think you need a vibration here and you need air coming through it, speaking of from an anatomical framework, there's a variety of ways we can make that occur. Just some are going to lead to a short career or problems. It's like stabilizing your upper lip. Sure, people can do it by trying to drag it down, but this is not a good strategy. It's kind of stretching the lip. It's making it vulnerable to tears, especially when you're mashing a mouthpiece into it. There's all sorts of things where actually to stabilize it in a way that you sort of see in brass, where, this is actually a strong stability. You have control. You're not making structures vulnerable. So I think, yes, we do need to look at the pieces and the system, both elements. When we look at blowing into resistance, it is still different from singers. I think what brass players or what wind and brass musicians as a total, what is a real shame is that you should learn how to breathe using all aspects of your breathing apparatus. Like, how do you use your ribs? When should I support more with my abdominal muscles? What about the timing of the pelvic floor? No one talks about the pelvic floor to wind and brass musicians, and there are so many problems with hemorrhoids and hernias and things like this that would be avoided if people understood that the pelvic floor has to be engaged prior to putting that pressure on the system when you actually blow into the instrument. So I think in training, it's actually the tide is shifting, as you've said. I think there are a mixture out there. Now I'm much more likely to be asked by particularly professional wind and brass players, on ways to improve embouchure, on ways to help their students, on ways to facilitate breathing. So, for example, if we said in sport you were running 100 metres versus 5,000 metres, it's very different how we train. And that doesn't happen in things like breathing and embouchure. Like you're doing completely different phrases. You've got fortissimo, pianissimo, anywhere in the middle, and actually then how you contract your muscles to control the air supply should be different. How long's your phrase? Are you taking a phrase appropriate amount of air? In some of the research I've done looking at breathing, a lot of the students are kind of hyperventilating all the time because they just keep topping up with air, which actually makes a lot of work of in-breath, and also they're not getting rid of stale air, so they're, under-oxygenating themselves. And these sort of things are important to teach. So why do you need to empty air? Usually they're not emptying air. Usually they're topping up because they don't understand how to control the air, the expiration, the out-breath. So they're kind of just keeping their lungs full in the hope that it's more likely that air will go out than in, rather than it being some controlled strategy. So absolutely. And I think health professionals can really help with this discourse with brass and wind players. And, I ran some training a couple of years ago in Germany with a combination of musicians and health professionals. We have to remember musicians know a lot more about embouchure needs or what's harder to blow or whatever than we do often, but we know potentially a lot more about the muscular apparatus. So often we have to work together a bit on this. And I've always been very inclined to work very closely with the musician in saying, we need these muscles to work, but the way they combine in and fine tune in performance is something that we want to liaise with the musician or the teacher and try and fine-tune that later stages. What's important for us is to get all the apparatus functioning, and then you can fine-tune back and get your musical nuances sort of back in track because you kind of know how to do it. And I think this not thinking and playing, we would say this is absolutely true. Like you don't want to be running 100 meters and wondering if you're engaging your core or something like this. I mean, when we're doing these kind of exercises, the idea in practice is to take little bits that you need to work on and to aim to get them automated so that when you get there in the concert, you're not thinking about contracting your pelvic floor. You've done that in practice sessions so that it's going to be kind of automated. So practice sessions about where we try and automate, where we explore dynamics with how we use our breathing apparatus. when you're in profession, when you're performing, you should be putting that away and trying to enjoy the, you know, the sound and the kind of nuances of that.
Yeah, I think having been through the journey, the best phrase that I can explain it is kind of set and forget now. It's
Yeah.
that I've been through that early chapter of really focusing in on the physical cues and where to feel them, how to feel them, the timing. And now in practice, I can see a phrase and the body instantly knows how to access those cues. And yeah, like you've talked about in the past, scanning the body and yeah, and I think that's that's been a really powerful tool. Yeah,
And
you
sometimes,
talked a lot about. Sorry,
sorry,
go on.
just one thing. I was just going to say, sometimes the transition from that practice room work to like rehearsals and things. I do say musicians always notate their score. Like it's about all sorts of stuff, whatever the conductor wants or breathing. If they're having trouble remembering an element, I usually say just put a little notation, and you won't have to then be worrying during playing, will I remember to do that at this point? Just put a tiny mark there to help you in that
Yeah,
transition initially when you're not confident.
I guess brass players now we only we do have a cue for that for a breath or big breath,
Yeah,
and that's
exactly.
the only physical thing at the moment. Um,
Yeah, but
you mentioned, yeah, you mentioned just you as a medical professional, you enjoy working with musicians to solve problems, and I'm just thinking about what is the future? What does it look like? Who are we training? Obviously you have a physio background, but is that necessarily who you think they are the only people that can be working with musicians? Or I wonder, what does the future look like? Who should we be training in the medical field?
I think
And from a
both.
musician's point of view, who do you call? You do, yeah.
I think both, and I think the great thing about the Embouchure Project is this idea that we encourage work from both directions. I mean, as you well know, once I've got people's system working functionally, I will often refer them to you to get it now working, to extend this function into high quality performance. So I think it's crazy not to work together. I've done a lot of interviews with musicians, and what a lot of them say is they don't really want to know all the names of the muscles and all the complexities about where they go and blah, blah. They just want to know how to use them and that's it. So in that regard, I think you need the health professionals. You still need people to sort of know where all the muscles go so we can really test them and check them, because quite often there's muscles not working that we have to do some fundamental activation to get the muscle working that then we can sort of put into a functional context. So we sort of go from breaking down and finding where there's imbalances or timing problems to then say use analogies. Like I think what's really interesting, even working with you, is I might start with a fairly typical physiotherapeutic or complicated anatomical prompt to try and get people figuring out how to find a muscle, harder exercises than you need for playing, but just so you can really feel it and find it. And then often you call them something cool, that prompts what it does without thinking, oh, yes, I must engage my pelvic floor now. Like, there's other ways that
Yeah.
music educators will use really simple prompts that often you can relate to. So I think we need that to musicalize medicine, but I think we need music coaches, if you like, who really understand it. But I think one of the problems that's happened in brass is there's been this very kind of pedagogical kind of, that's not how I teach it, and this is what I know. And I understand that because you have a framework that works very well for you in teaching brass playing. But I think we need some people to be able to kind of step out of that a little bit and be able to reintegrate them into that framework musically, as well as me kind of, or health professionals trying to get all the functions coming back together, that the musician helps let them see that framework can be accessed again. But you just can't jump straight over into it necessarily. We need that kind of transition, musical transitions back into where you want to go. And I think professionals and music educators, if it's a student, you guys can work together to an extent. But I do think it's hard to just rebound onto just do a fish face or just blow and relax your face. And these things are not very helpful in that stage of trying to learn control during performance. So we need both. And for our profession, sure, you can do some kind of scanning and say, oh, there's no tear, you're fine. But in fact, they can be very not fine because the muscle doesn't know how to activate at the time when it needs to. So not having a tear is one thing, great, but not being able to use it is still a massive problem. So we have to be careful of saying, oh, there's nothing wrong, when actually if the timing's all wrong, you can even be really strong in muscles and still almost choke yourself playing, like absolutely be unable to play because all the order's wrong.
Yeah. So for medical professionals at the moment, are there many resources out there, or what research do you think needs to be done in order to help people? Or is it training? Is it...
I think you need both. I think there's a little bit now on embouchure. A dentist wrote the first book back in 1967, can you believe, called The Embouchure, Morris Porter. And I've got a copy of that original book, and it's nice. He really tried to kind of start to talk about it, but then there was kind of more or less nothing for a very, very long time. And in recent times, there's been a little bit more on that. Medical Problems of Performing Artists is a journal specifically devoted to looking at problems with performing artists and often musicians, and that has some embouchure assessment and training articles in it. Interestingly, I'm trying to publish a couple of articles at the moment on the topic, and a lot of journals will say, oh, it's too niche. Like it can be difficult to even get research published on something that actually there's no information out there. We want to put it out there. But so I'd suggest going to targeted performing arts journals or searching embouchure. We haven't probably talked about it, but embouchure, this word is specifically referring to this interface, how you use your face to interact with the mouthpiece of an instrument. So when we're talking about embouchure, we're talking really about a complicated system of orofacial, pharyngeal kind of actions that interfaces with you and your instrument. So looking up the word embouchure will be the most targeted. If you looked up orofacial problems in wind and brass musicians, you might see there's quite a lot of statistics stuff, but not so much training. And that's something I'm working on now, is trying to train people. I'll say personally, as an anatomist and a physiotherapist, I have done a lot of research and digging deep and back into the last century to try and find these tidbits of information talking about pressure and volume and how some of these structures work. It's really been a big process to sort of gather this expertise. So I'm trying to put it together at the moment in a way that's more easily transmitted so other people don't have to do that. But yes, watch this space. I would really like to teach people how to assess it. And there is, as I said, there is some stuff, not a lot at the moment, but yeah, it's coming. I think we're all keen to get the information out there as much as we can.
Yeah, oh, it's really exciting, and we really appreciate the work that you're doing and the amount of musicians you've helped over not only in Australia but all around the world is there's hundreds, if not thousands, and the work that you're doing is really important. And yeah, I hope this conversation kind of gives confidence to medical professionals that it's not this this other world, that it is something that that they can take on. Or if a lot of musicians do end up becoming doctors, if they kind of give up music, it seems like it's almost like a natural progression for a lot of musicians. I'm not sure why.
But yeah, I think people won't be scared of it. Just one of our problems is we don't get taught enough about these structures. And, I have tried to put a lot of that into my particular anatomy classes. They're getting a very abnormal amount of musician-specific anatomy added to the swallowing and stuttering and stuff like that. But I would say we need to remember as health professionals, we have this capacity to think about how muscles function, the importance of how you train them, the importance of muscle balance, the importance of timing. As health professionals, we do know this. Like, we just have to not panic that it's a face. We have to think a bit logically. We have one main oral constrictor, our orbicularis oris, and then various muscles that create tension on it. In the case of a brass player, where really you have to maintain an orbicularis oris form and kind of vary the amount of tension on the system. But yeah, don't be frightened of it, but if in doubt, seek help. And I do think trying to, at first instance, think logically about how muscles work and the importance of timing. And our lungs are the big gross motor control, and there's a lot of fine motor control of them inside the mouth of air, but then these facial muscles adjusting aperture. It's not too technical, but yeah.
I guess my biggest piece of evidence that I love giving people that are either skeptical or interested is that I got injured. I couldn't play a single note on the French horn as a professional player, and then I learned how to play again from scratch from a physio. And you're not a brass player. You don't know how to play French horn. You heard me maybe once or twice before my injury, but it's not that you can teach me how to play French horn again. But the reality is that I learned how to play again from scratch from a physio. There's got to be something in that, and I think that's why we're doing what we're doing, because I truly believe, I know that it works, and people need to know about it. And
I think just to encourage both health professionals and musicians not to be so afraid of this area, because really we can do incredible things. I would say I see a lot of people where the problems aren't even, I don't know how to say this exactly right, but the problems are profound to the musician, but actually not that bad. They're quite quick to fix just by really being methodical in how you assess it. So sometimes people are sent with problems that, for them, they can't play. It's potentially career ending, but then you look and you think, wait a minute, there's just this timing problem that's creating a big repercussion, for example. So it's very variable what I find, but often you can do much more. It's just very poorly assessed, I would say, on the whole, because people don't really understand the system well enough. But
and when we're talking about timing of it in golf, it's well known as the yips. It could go into that, and the same thing can happen with brass players when you're producing a note. But this kind of or confusion that happens. But so that's Anyway, it's been great to.
I haven't talked about that much. I will just say it at the end for health professionals. Often dystonia is diagnosed. I mean, of course, you want a neurologist. Be careful of it getting too quickly self-diagnosed or diagnosed by others. And I would say if you're leaning, even as a neurologist, if you're leaning towards that diagnosis, it's worth reaching out to some of the medical embouchure experts just to ask them if they concur with that. Like Steve Frucht in New York is well known. He's been doing embouchure dystonia things for years. Movement disorder specialists who have a background with musicians, there's a few around, but just seek help if you're not sure. But it's certainly, I find embouchure dystonia, look, it's the hardest thing I've ever treated, I have to be honest, because there's so much going on internally, but then it's very rewarding when you can fix it just by getting the system working. And I think the musicians really need support, like psychological support or mentoring support in this phase with especially severe conditions like dystonia, because it's going to take a year to get better because the system's completely dewired. And you'll hear a range of people who've improved from sort of anywhere between 1 and 7 years. Often people don't at the moment because there's no real clear treatment options. But I think we're seeing now this shift that if we follow these kind of protocols, so I've got a protocol where it's really building upon, like, taking all the pieces, getting them working together and then combining them back together in the right timing. And these sort of things are proving to be very effective, really. We just haven't had a guide before now.
Yeah, and I think you've shown me even a kind of a handbook for general practitioners. If presented with focal dystonia, one of the only avenues that they're pointed to is Botox, and there's a lot of talk about Botox, and it's coming out now that it's actually not a long-term solution for musicians to be able to do the fine motor skills that's needed.
Sometimes in the hand, people are getting a lot of recurrent Botox and it's managing. It's much harder in the orofacial area because, as I said, you don't have this bone-to-bone connections, like muscles connect to connective tissue and fascia and other muscles. And by eliminating one, often the whole system kind of twists and warps differently. It's not like taking out a muscle in the hand where now you won't pull that finger so much. It's a little more straightforward to do when people are doing it in the hand. And, for some people, retraining, as you know, I think you have to explain to them, look, the system's got very confused. We're really rewiring the brain and trying to get conditioned back in all the necessary muscles and getting everything back in order. And this is a time-consuming process, but you have to sort of be patient with it and positive, and often you'll need support to get through this process, because I think there's this feeling of shame that your embouchure has fallen apart, when really it's just incredible you can do it in the first place, to be honest. Like it's a fantastic sort of skill of the human body. So I think
it's
there
your
is
identity as a musician. It's everything. You've been doing it since you were a kid, and it can, to have it ripped away from you is horrific. Yeah. So, but.
And I think the other thing I would say to health professionals is work with the musicians to try and understand what they know. I mean, ask them what they know about it, try and understand the framework they have, because embouchure is the most, if you like, difficult thing to work with musicians, because they've been told not to think about it. So to even start talking about it can be incredibly confronting. And, I know some of the guys, when you talk to them, they're like, whoa, wait, everything you're telling me, it's like, it's all like what I've been told not to do and not to think about, in the sense that now we're saying, look, it's muscles. I always pull out my little head here and say, look, muscles, we got them in our arms. We're not scared of them. We just have to learn how to use them in the right way. That's all.
Yeah, no, definitely. Yeah. Oh, it's been fantastic, Bronwen. I really appreciate your time, and look forward to what we can do in the future. Yeah.
Yep.
Yeah.
Thanks,
All right,
Frankie.
thanks again.
Thanks for listening to this episode of the Embouchure Project Podcast with me, Frankie Lacerda. The strength of this project is our network, so please go to the embouchureproject.org to sign up for our mailing list, follow us on Instagram, and join our group on Facebook. If you have any questions, please don't hesitate to email us at info@theembouchureproject.org. We look forward to hearing from you.